little shorter than this. All right, everyone. I'm Danielle Doheny. I met a lot of you earlier, but for those of you who don't know me, I'm the Director of Public Policy and Advocacy for the IMF. Basically, I'm the federal lobbyist for myeloma patients. Everybody has a lobbyist, and myeloma patients need one too. But I'm going to talk to you today, one, about what advocacy is, why it's important, and why you might want to get involved with it. And then I'm also going to talk about some important changes to Medicare that are coming up that anyone who is in Medicare should pay attention to, because there's some big changes that actually we advocated for, but there's some caveats that we'll all kind of need to know about to make sure that you're taking advantage of the changes. So what are the things we advocate? There are kind of three buckets there that we'd advocate for. First and foremost, access to care. So there's a lot, as Dr. Joe was mentioning, a lot of new medications out there that are amazing, that have changed the lives of patients everywhere. My dad being one of them, that's why I got into this myself. But we want to make sure that people can access these, that just because they're there doesn't mean everybody can have it. We want to make sure that that's not the case. We want to make sure that any person who has myeloma can get what they need. Number two, financial barriers. We know a lot of people have issues affording their medications, so we want to make sure that that's something that isn't happening to people. And the third one, research funding. That's a really big one. We want to make sure that this progress continues, and we really want to make sure that, it's a passion of mine to find a cure for myeloma, and not being a researcher myself, advocacy is a way that I can contribute. And this is just a little bit of a bigger picture snapshot, just so you can see some of the things in that access to care bucket. We have something called insurance reform. That's things like step therapy, where your insurance company might say, hey, you have to try this drug before you can have this one. And your doctor might be like, well, I know that's not going to be the best course of treatment for you, and you have to fight the insurer. So we're trying to make sure that you don't have to fight insurance companies to get what you need. Also, telehealth and telemedicine, we want to make sure that that is robust and available for patients. We want to make sure people can get that. And then oral parity, I know a lot of you probably have noticed that your out-of-pocket costs for like your Revlimids and your Pomalyst, things that you're taking at home, are a lot more expensive than what you're taking in office. And we don't think that that's okay. We work with a lot of other cancer groups on this. We're not the only ones. So we run a coalition on that one. And Medicare reform. This is a big one. We hear a lot of access issues from our Medicare patients, so that's something we advocated really heavily on. And then in the research funding, there's just several buckets that we advocate for there. And within that, that's clinical, and we include clinical trial diversity. We want to make sure that anybody who wants to participate in a trial that's eligible is able to do so, that there aren't barriers there. And I think a lot of people say, like, well, why would I want to do this, or why does this matter to me? That's where I want to present to you today and really just tell you the why. I have pictures here of several of our patients that have come with us to Capitol Hill. So legislators don't really move or make changes unless they hear from people. I can come to them all day with sheets and sheets of facts and figures, but until they hear the story of somebody that really humanizes something to them, they're not going to make a change. I used to work in a congressional office as a staff member, and people would come in, and sometimes everyone in the room would be crying by the end, but you can bet that absolutely I would make a recommendation to the member of Congress I worked for to support that person's bill that they're coming into me to talk about, because it's important. And I think without that personal story, no one is going to know how important it is to make that change. And I think you might also be asking yourself, a lot of people are like, well, I can say stuff all day and no one's going to change anything. I just wanted to talk specifically about those Medicare changes, because those are something we advocated for a very long time, and it happened. That wasn't just the force of IMF, that was the force of every disease advocacy group in the country coming together and saying, we want this. Medicare created an out-of-pocket cap for drugs So starting next year for your plans, no one who has Medicare will pay more than $2,000 over the course of the year. So that's because of advocates, people like you who came and said, this is a problem, I can't afford my medication, or this is just, or I'm having to go to all these copay foundations and see who has money, and it's just really devastating to my family. So those stories were shared. So I'm just going to talk a little bit about what those changes are. First and foremost, some of these have already started, like no copays for vaccines, insulin copays that are lower, and then 2024, there's something called the Extra Help Program that I recommend to everyone to look in and see if you might qualify for that, because that's going to be a big relief to a lot of folks. But I think a lot of people don't realize that they qualify for it, one, and two, it's a really big percentage of people who will qualify. And I think the thing that's really important, Medicare won't automatically enroll you. So you could potentially take advantage of some of these benefits, such as like lower out-of-pocket costs, and not even know it. And then in 2025, the big piece that will be amazing for everyone, that out-of-pocket cap. And this is one thing that I think is really important for people to know about, that there's something else we advocated for in there called the Medicare Prescription Payment Program, or they call it the MP3. It's ridiculous, I know. But it's basically a mechanism where you can smooth those costs. They call it smoothing mechanism, where you can take those costs and spread it across the course of the year. So instead of like $2,000 in January, you can have payments that are about like $166 a month. But you have to opt into that. You have to go to your Medicare plan and sign up. And we as advocacy groups are really trying to push that out to people, because I've presented to a lot of support groups on this now, and not one person has known that this is a benefit that they can take advantage of. So it's really important. We have some points there that I think just folks need to know. So you just have to know that you have to opt into the program. And then two, know that you're going to pay so much less next year. And we're really excited about that. It used to be there was no limit and you could just pay. And now $2,000 over a year for drugs, it's going to be fantastic. And I just wanted to put this other slide in here just to show you, it's from the Wall Street Journal. It just shows the difference in cost from this year to what folks will pay next year. Everyone paying $2,000, and as somebody who has like a parent who has been on these drugs, just to see this makes me so happy, and it just really shows that advocacy matters. So this will be something that we can all take advantage of in the future. And I wanted to show a little bit of what we do, just a little bit of some of our successes we've successfully advocated for some research funding. And I've got some of the programs that we have had that success in. We've brought some patients in to do a congressional lobby day with us. And it was the American Cancer Society was the lead on this one. But they brought people in just to ask for increased cancer research funding overall. And it was a great experience for our advocates. If that's ever something you'd want to do, we would love to have you sign up with me or talk to me more about it. Then also we had a congressional briefing just to educate staff on a lot of these issues that people were having, specifically the one we call oral parity, but that's the one that has to do with the oral oncolytic costs versus the IV. And we had people talk about, I can't afford my medicine, I can't, a man who came and spoke about how he couldn't sign his kids up for the sports he wanted to because every month he was going to, and their family maid was going to his medical care, and how much of a difference this would make. So they also met with staff on congressional committees. And a big dream of mine ever since I started here would be to have an IMF lobby day where we would bring our patients in, anybody who wanted to, and they could come and tell their stories. That's basically all advocacy is telling your story. I want to also make that clear. Like, you don't have to go in and say, I know all about this policy. What you're doing is saying, I have myeloma and this is how I was diagnosed. These are the challenges I've faced. That's all they need to know. So I'm really excited. I hope you'll join us. Do we have time for questions? Do you guys know? Yeah. If anyone has questions about advocacy or about the Medicare changes, I'm happy to take them. Yes. Okay.
Danielle Doheny, I thought it would be fantastic if people write down the website where they can get called.
Oh, yeah.
Like your contact information.
Yeah. So up at my booth, I have a QR code that folks can take. And I also have a sheet you can sign up on. So go ahead.
So, my name is Len. Had myeloma for 13 years now. Thank God all is good. I have a question for you. You mentioned the $2,000 out of pocket next year. Mm-hmm. Does that mean the donor toll will disappear altogether from Part D?
It does. Yes.
Good.
Yeah, that was something that we heard from a lot of people was a problem. And also, you reminded me, if anybody has things they want to see changed, come to us because we will be your advocate.
And
basically the same question about the $2,000 deductible for Medicare. I was wanting to know, what if you don't have Part D?
So if you have an Advantage plan, it applies there, but it's only Medicare. So it's Part D and Medicare Advantage. It's their drug plans too. So it encompasses that as well. Does that answer your question or?
I get by into regular Medicare.
So you would have to have like a Medicare Part D and have the drug insurance coverage as well. So it's yeah.
I'm sorry.
Hi, Danielle. Question on, I just saw that there's 10 drugs that were approved through this new Medicare thing. Mm-hmm. I noticed that one of them was a blood cancer drug. It was for leukemia, I believe.
Yes.
Anything in the works for myeloma?
Yeah, so those, the first 10 were the ones that Medicare selected. We should get the next 10. I think it's in a few weeks, actually. So we will be able to see if there's a myeloma one there. We won't know the answer until Medicare comes out with those next 10, though.
Hi, Danielle. First of all, thanks for your work in the advocacy role. Very much appreciated. My question is, am I hearing you correctly about this year, 2023, and also, 2024 and 2025, that we must opt in with our Part D pharmaceutical coverage?
Yeah.
You have to call them and opt in.
So everybody will get the $2,000. The opt-in is for the ability to make those costs not all in like January. It would be like to spread it over the course of the month.
Thank you. Is it too late to opt in?
No, this would be
2024.
So 2024. It doesn't have it yet. So this is for the next plan year.
For the next one. Thank you very much.
I have a question. Thank you for your advocacy. I purposely did not sign up for an Advantage plan. I got a separate prescription plan with WellCare. Can you buy Part D separately? And would I have to opt into Part D, or do I have to join an Advantage plan?
So do you have traditional Medicare?
Yes.
Okay, so traditional Medicare, and is WellCare is not a Part D plan?
Pardon?
So WellCare is not a Part D plan?
It's a prescription plan only.
So if it's a prescription drug plan for like Medicare recipients, my understanding would be
It's separate than
okay. I'd have to look into it.
Okay.
If you meet me back at the table and give me your info, yeah.
I just wondered if you knew. I think all of this is so new that
It is.
there's going to be a lot of questions.
Yes.
I really appreciate
Yeah, and we
this.
actually have an open line with Medicare as well. So if it's something that like I don't know, we can always ask the program managers too. Like, yeah. Good for time or
Other questions?
Hot topic, right? Yeah, it's a hot topics today.
It's-
Okay, thank you very much.
Yeah, if anybody has questions afterwards, feel free to, I'll be out in the hall.